Thank you very much for this invite. My short bio is that I'm a doc who's been doing drugs for at least 30 years. I feel very privileged to be invited here because I'm slightly a novice of this, in this conference. It's my first time here. And I've just been impressed by many things, but two things particularly, is the passion and compassion in all of the audience. And the second thing, the overwhelming commonality between our struggle around the war on drugs, on illicit drugs, and the war on nicotine. So I'm hoping that I will bring some of those out. But I have to say that I've learned so much, and thank you for that. My street cred for standing up here is that actually I was a smoker for 30 years, on and off, and tried many things to stop, including the good old nicotine replacement. And I didn't, I'm a doctor. I got an allergy to the patches, so I was moving them around. And one time I was going to do some teaching, so I thought, well, I'd better not have one on my arm, just in case somebody thought, what's she doing with that? So I put it on my chest. Well, anyone with any common sense, let alone doctors in the audience, will know if you've got a blinking patch of nicotine on your heart, you're suddenly becoming even more spacey than you are himself. But the thing that finally got me to stop smoking was two things. One, I became a Thursday and night smoker because the person I worked with on a Thursday smoked, and he was like my dealer, nudge, nudge, wig, wink. I didn't buy my own. And when I went home from smoking on Thursday, my partner said, no snogging on Thursday, because she was a non-smoker. So that got me thinking. So I happened to go to the 2012 Harm Reduction Conference in Liverpool and was given my first e-cigarette. And the rest is history, that I haven't had a cigarette. I've had the odd puff when I've been a bit drunk, but I've never, ever enjoyed it. So I think I've got the street cred to be here. So I've changed the title. And I want to thank Sebastian, Saville, who I work with their help in terms of this presentation. Cigarettes, what can we learn from heroin? And the present role is a clinical director of International Doctors for Healthier Drug Policies, and our aim is very simple, is getting health as the cornerstone of drug policy, in brackets rather than criminalization. I don't need to go into the guys have been, sorry? Oh, am I pointing it the wrong way? Anyone over 60 in the audience? Anyone have problem with technology? I do apologize. Many people in the drugs field, and it seems the same here, think that somehow harm reduction is a dirty word. In UK drug policy, harm reduction is seen as a dirty word. Oh, you're encouraging it, you're naughty, you're horrible. These people are bad and they need to pull up their socks. Well, actually, we all do harm reduction every day. We do it in, what is seatbelts but harm reduction? It doesn't stop you being killed in an accident, but it certainly reduces the incident. Looking both ways, all of those things are exactly what harm reduction is. Oops, passwords, that's a good one. Fundamentals of, what are the fundamentals of drug harm reduction? Well, actually, they're lessening the consequences of drug use, which is exactly what harm reduction is in the smoking field, is lessening the consequences of smoking. We're trying to keep people alive, we're keeping them out of the morgues, and also, thanks to Dave, giving them some pleasure. And I think harm reduction for me, particularly in drugs, is absolutely essential because it's working with where people are. There are many people who cannot stop using drugs and do not want to stop using drugs, but actually we can make it a far safer very easily. And this is based on public health and human rights. So what is harm reduction in relation to cigarettes? I don't need to go into this. But for me, it's the delivery system that causes the problems. That it's not the nicotine that is causing the problems. It's the delivery, which is the tobacco. You all know it's the smoke, it's the carcinogens in the smoke that are causing the problems, not the nicotine. Just like heroin, if I took in clean needles and syringes, heroin every day, by a clean delivery system, I would be fine. I might have a dependency, but I would not be, it does not cause any health problems. It is the needles and syringes that cause the health problems that transmit HIV, hepatitis C, and that you have to deal with getting your product from a dealer rather than from a legalized source. So what do we do? What did we do in heroin around delivery systems? Well, we provided needles and syringes, clean needles and syringes, and we provided agonistic opiate treatment for people who need it, such as methadone and buprenorphine. How many people in this audience have seen bad press around methadone? Yeah, everybody's hand has gone up. Methadone is exactly like e-cigarettes in that the press is overwhelming. You'd think it was the devil's brew that methadone. Methadone is the most researched, evidence-based drug there is in the whole wide world. And it works just like, well, you can't say it's the most researched nicotine delivery systems, but actually there's a pretty good evidence base. So the cornerstones, for me, of harm reduction are providing needles and syringes, providing of drugs like methadone, and the other one that we sometimes forget is about providing a health-based, rather than criminalization, drug policies, which is a balanced and integrated whole system, including prevention, treatment, and supply. It's common sense, it's cost-effective, and it takes out moral judgment. In our field and the vaping field, there is too much moral judgment, and I say, ban moral judgment. We need to work, and I've seen that at this conference, with dignity and compassion, and we need to make people feel valued. And that is the same in people who inject drugs, opposing stigma wherever we see it. So if we take, I mentioned HIV, that if we look in countries that have a comprehensive harm reduction strategy with all of those elements, people who got in there early, you can see the countries, the UK, Australia, Switzerland, who have very low harm reduction and very low HIV rates. You go on to countries that didn't introduce them early, and Portugal they responded to their very high HIV rate by now having one of the best systems possible, but they've still got a higher than the UK rate of HIV because of that history. The other countries, particularly the US, have not taken on. You're more likely to end up in prison if you use drugs than anywhere else in the world. Well, actually, that's not true, because Russia's a bit worse. But if you're black and use drugs, sorry, you've had it. This is a racist, US is a racist country, as many of us know, and people end up in prison if they use drugs. In countries which haven't introduced harm reduction strategies, I think for me, Thailand is a real sadness, is that many of you know that they introduced a really good policy in terms of sexually transmission of HIV in the condoms and cabbages. On the fruit markets and the vegetable markets, they handed out condoms. So the HIV rate, the sexual transmission of HIV rate went like that. They did not do the same for people who inject drugs. And in fact, they shoot people or put them in detention centers, prisons, with people who use drugs. They see it as very much a bad thing that people use drugs, and they don't help people, they shoot them or put them in prison. In Russia, many of you might have seen in the press about 2 to 3 months ago, maybe a month ago, I don't know, that actually Russia reached its millionth case of HIV in people who inject drugs. HIV in injectors is a completely preventable disease. That is inhumane and unacceptable. Whereas when you put all of the pillars in of drug policy and the whole system into a country, you can see that actually it's spectacular that drug-related deaths have reduced by 50%, HIV's gone down. Most people who want to be are in treatment. And even for those skeptics who who think junkies are a bad thing, then actually 90% of reduction in personal crime. So surely that's about a whole, system. One of the things people say about drugs is, does harm reduction encourage drug use? I like a bit of audience participation. Does it encourage drug use? No, absolutely not. It's prevented HIV, it's prevented thousands and thousands of overdoses, and we know that actually it's the best way to get people into treatment, a gateway to treatment. If people feel valued, if people want then to go on to treatment, they do. And the rest is conjuncture. Are we seeing the same for cigarettes? And I don't need to read this one, but tobacco, as you know, kills more people than anything else every year. Some of the figures I've learned over the last couple of days really shock me. It kills 6 million people a year. Tobacco kills half its users. And the one that I want to stress as well, that has come out in some of the talks, is that 80% of the world's smokers are in low or medium income countries. This is a disease like drug use. It is a disease of poverty. And actually, why do they put advertisements in, low-income countries? It's because they can get more people. This is not only about money, but it's about poverty, it's about oppression, and we must fight that. And obviously, in those low-income countries, the burden of death is much harder if the worker, the main breadwinner, is actually killed off by smoking, then the burden is highest. So we've heard this over the last couple of days. Does providing e-cigarettes encourage smoking? Answer? No. Absolutely. Yet again, we hear a lot of this, and I'm really, really still shocked that even on the film, that, there were people of my profession saying nicotine kills. No, it doesn't. The statistic that's really stuck with me, that e-cigarettes are from the report that came out, 95% safer than cigarettes. Is that not to you a no-brainer? And I think it's the most important thing is that we can stop people dying. So I put to you that cigarettes can learn a lot from the heroin experience. If I was doing this presentation now, after being here for 48 hours, I would say that heroin can learn a lot from cigarettes as well, because I feel as if I've really learned from you. But I thought I'd put in a tiny bit of medicine at being a doctor, pretending to be a doctor. The top 3 of the top 10 killers in the world, ischemic heart disease, stroke, chronic obstructive airway disease, the three top ones are completely related to smoking or tobacco. Surely we must do something about that. And I think to finish, what I'd like to say is that this also came up over the last 48 hours. For me, that actually vaping, I now realize, is the biggest public health intervention in my lifetime. And actually, we must think that in 20 years' time, we cannot still be having these arguments. Vaping should be available everywhere, and we should get away from this. People have used drugs and smoked things for centuries, forever, and people are going to always seek pleasure. I'm glad I like pleasure, and actually, you know, that actually, why can't we just accept that actually vaping and, you know, take out the moral judgment and let's go and do a bit of happy vaping. Thank you.